Now, there are some guidelines I want to show our viewers, and I want to see how you incorporate these guidelines, because I don't think every patient could do the same thing. But moderate exercise, 150 minutes per week, or vigorous exercise, 60 minutes per week. These are general physical activity guidelines. What are they and who sets them?
These guidelines are set by the American College of Sports Medicine and the American Cancer Society. The general recommendations, again, because there wasn't a lot of research on cancer patients in terms of post-treatment and longevity, they were based off of originating guidelines that had to do a lot with what they've seen in heart disease and diabetes. So the general guidelines really focus around that, and there's still some research that needs to be done to determine guidelines specifically for cancer. The 9 to 15 minute hours fall somewhere in between 150 to 180 minutes of aerobic exercise per week, and that's what we generally recommend to each person. Again, that is if it's moderate exercise, and moderate is going to be different for everyone. So moderate for a person who may be 80 years old and is inactive might be walking at 2 miles an hour, whereas a person who is maybe 35 and works during the day, their moderate might be 3.5 miles per hour. So you have to be very specific to the person when you say moderate, what that actually means. Vigorous activity, again, not everyone should be doing vigorous activity. It really depends on the person's aerobic capacity, and that's why we try to determine that first, because our younger patients, mostly how they come in before, it's a good indication of how they're going to be right after, depending on how long their treatment takes. But if a person's very active, if they're like an athlete and they come in, they're used to running marathons, they get diagnosed, they're not going to come in and then start usually at like 2 miles an hour. So you have to be able to tailor everything. They may be able to tolerate vigorous activity, but a person who comes in and is 84 may not. So you have to individualize it, and then again define what moderate and vigorous is to that person. Also, it's okay, most people would like to go with kind of like a talk test to determine how difficult the exercise is. So that's a simple way. If you're not used to using like a heart rate method, how we use, you can use a talk test, which is how difficult is this exercise? Am I able to carry on a conversation while I'm doing this? And that's usually how you kind of create that little division between moderate and vigorous. If you're unable to carry on a conversation and the exercise is too difficult, then it's considered more vigorous intensity for you.